Sometimes you may look and feel okay, but your overall health may not be all that it should be. Dr. Todd Munsey from Foundations Integrated Medical and Sports Health is here with some information we can all use to improve our life and our health. Good morning, Doc.
Hey, good morning. Thanks for having me again, Chris.
Good to see you. It's a common everyday thing. You may be feeling okay, you may be looking okay, but there may be some issues in the background that you need to take care of.
Absolutely. You know, the World Health Organization defines health as when all tissue, cells, organs in our body are all functioning at 100% of the time.
Right.
It's not simply the absence of disease or infirmity or symptoms.
Right.
We, as a society, have started basing ourselves on our vanity system, right? We look good, we feel good, so we're healthy.
Right.
Well, that's not the case in most cases. Most people, you know, have some underlying issue, and that's what we're trying to look for. In my world, in chiropractic world,
right,
we try to find those underlying issues and fix them and help the patient heal.
And a lot of those issues can be traced back to the spine and the nervous system.
Absolutely. You know, we call that the safety pin system where I'm from. And the safety pin system, we all know what a safety pin looks like for a diaper or something like that. When you pinch it closed, it's one solid piece, and then you open it up and it opens. Well, that's what happens inside of our body. We get in that safety pin cycle or closed loop system where we have a health problem, an underlying health problem that we don't know about.
Right.
And it causes our spine to misalign, or nerve interference. It causes us to have an irritation there. Well, as doctors of chiropractic, we can actually feel the spine and find things. So take, for instance, asthma.
Right.
It's a simple one. My mother has that. And that, you know, we can fill up her spine and find that area that's real tight that doesn't want to release. It just doesn't want to release no matter what we can do. And if they have asthma, then the asthma triggers that to happen. And at the same time, that's triggering the asthma to happen in a lot of cases. So it creates that closed loop.
Right.
What we want to do is remove that interference in the spine and the nerve system so that she can start to recover from asthma better. Does that make sense?
It does. It makes absolute sense. Because I think, you know, we all forget that our brain and all of our internal organs are governed by what goes on from the brain down through our spine and that nervous system.
That's right. It's above, down, inside out.
Yeah.
That's the way God designed us to heal. The brain sends the signals to tell us how to heal. And if we put information in that system that's bad,
right,
what we get out is bad.
Right.
If we put good information in that system, what we get out is good information. So if we have an issue that's going on inside of us that is bad, that our body doesn't recognize, we may look good and feel good at the time, but it's causing problems. And through that nerve system and through that spine, sometimes we can figure it out and start helping the patient heal.
And you know, a lot of times we treat the symptoms. And that's a lot of, you know, if I'm feeling bad, I got to get that taken care of. There's times when you got to do some maintenance.
That's right.
You got to take care of. It's like any piece of equipment. You got to do some maintenance.
Well, if your car runs out of oil and you blow your engine, and you take it and put a whole new engine in it, you spend $3,000-4,000 putting a new engine in it. Are you going to change the oil the next time?
Yeah, absolutely.
Are you going to maintain that oil change from that point?
Absolutely, yes.
Well, that's exactly what we should do with our body. A lot of times we see people come in after the damage is done, and then we start to help them repair that damage. And once we get that damage repaired, we recommend a wellness plan for them to keep them well. It's kind of like doing maintenance on your car after that same engine problem.
And I think a lot of folks can present with other things. They have like digestive issues or things of that nature that can be helped with chiropractic as well.
Absolutely, because we get a response from the nervous system. Again, like we talked about, it can be irritated back at the spinal level.
Right.
And once it's irritated, it can cause digestive upset or gastric upset in that case.
Right.
And so if we remove that interference that's causing that, then a lot of times those will go away. Now, that's not a cure-all and it's not an end-all, but it does help and it does improve the system. And sometimes, yes, it does go away and it does cure itself.
And you encourage folks, you may be feeling good, you may be looking good, but if you've been on a regimen of chiropractic care or other types of care, come in and see you and get evaluated, if nothing
Absolutely.
else.
Even if you haven't, come in and get seen. Even if you feel good, look good, have that spine and nerve system evaluated, because that spine and nerve system can be a hidden symptom of what's going on in a bigger system of your body.
Right.
It can actually indicate problems going on before you know you have them. I'll give you an example if we have time.
Absolutely, go ahead.
A quick example, had a young man one time come into my office and we were checking his spine. I get to the area somewhere around T6 to T8, and I knew that he had diabetes.
Right.
Well, I tried to adjust him. It wouldn't release like normal. I just could not get something to go on. So my first question that came out of my mouth to him was, are we having problems with our sugar today?
Yes.
And he said, no, I've got my monitor on. It's working just fine. It hasn't beeped and alerted me and let me know anything. Well, he called me back after he'd left because I told him I think we need to have that checked and we need to you know, make sure everything's okay. He got home and he called me back and thanked me for alerting him to that, because what had happened is his batteries in that system had had died,
right.
and he was on the reserve component of that system, and he was getting close to diabetic coma at that point.
Oh no!
And that's something we don't want to let happen.
Right. You
And
don't want to get to that point.
That's right. And our spine can alert us to that.
Yes.
It can alert us to people that have heart disease. If the thoracic spine's too tight for us to get it to move on any given time, a lot of times we'll send that patient out to a cardiologist or their general practitioner and have them checked, and come to find out they have heart disease that wasn't diagnosed.
Dr. Muncie, we could talk about this all day. This is a fascinating topic. Thanks for stopping by today.
Hey, thank you for having me.
All right. You may be looking good. You may be feeling good, but it's time to check out everything. Check out under the hood, so to speak.
Absolutely.
And go to Foundations Integrated Medical and Sports Health. Get checked out today. Take care of those issues and take care of yourself.
The preceding portion of Daytime Tri-Cities was sponsored by